Hey Nathaniel, I heard you take Adderall every day. How does it help you?
Well, it helps me focus throughout the day.
Oh my gosh, a shiny quarter!
Did you remember to take your Adderall this morning? Over here. Did you take your Adderall?
I don't think so. I forgot.
Okay, well, when you do take your Adderall, do you notice the difference?
Yeah, well,
I heard a joke the other day. You want to hear it?
No, Nathaniel, I just want you to take your Adderall. Here you go.
Adderall!
does Adderall make my butt look big?
I am here with Dr. Stephen Klump, an attorney and judge who holds a master's degree in pharmacy from the University of Florida College of Pharmacy. Good evening, Dr. Klump. Could you tell us why Adderall is prescribed to patients?
Well, good evening, Jill. Adderall is prescribed as part of a treatment program to control symptoms of attention deficit hyperactivity disorder, what's commonly known as ADHD, more difficulty focusing and controlling actions and remaining still or quiet when children especially have a difficult time doing that. It's also prescribed as a treatment for narcolepsy, which is a sleep disorder, which causes excessive daytime sleepiness, sudden attacks of sleep. It's in a class of medications that are called central nervous system stimulants, and it works by changing the amounts of certain natural occurring substances in your brain.
So, doctor, are there any other uses for this drug?
Well, it has been known to treat depression and shouldn't really be used to treat excessive tiredness, but that is not caused by narcolepsy in particular. It's not intended to be used as a medication necessarily to keep one awake. It might be prescribed for other conditions. Doctors do tend to look for other uses for medications, and that is an acceptable practice as long as it's safe and effective.
Now, Dr. Klump, are there side effects associated with this medication?
Yeah, there are side effects associated with many medications, and that's not necessarily a good thing or a bad thing. It's really a case of balancing the efficacy, the term is called, as the effectiveness against the risks associated. But some of the side effects are nervousness and restlessness, vomiting, nausea, stomach pain. Prolonged use might lead to some constipation, some weight loss or loss of appetite. There are certain side effects that can be more serious, and those would be like shortness of breath, chest tightening or pain, excessive tiredness or fatigue, faintness, weakness, or seizures. One of the more strange side effects is believing things that are not true or feeling suspicious of other people. But it's all a matter of balancing the risks with the effectiveness of the drug.
Now, Dr. Klump, we know that we are supposed to take medications as prescribed by a doctor, but there are people out there who don't take them how they are supposed to and may overdose. So what are some symptoms of an overdose?
With Adderall, one of the primary symptoms is fast breathing and uncontrollable shaking on part of your body. There's confusion. In some cases, there's aggressive behavior. Many times there's feelings of panic brought on by the increased blood pressure and uncontrollable shaking of the body. Sometimes fever is part of the symptom, muscle weakness or aching. And of course, the vomiting and diarrhea, upset stomach are all part of the signs of overdose.
Adderall should not be made legal for use by the general public as a study drug. This is because of the harmful side effects and the high potential for addiction. One possible solution to the growing problem that is becoming more common among U.S. colleges would be to inform students of the medical, legal, and social risks caused by the illegal use of Adderall. Adderall is a risky medication to use and therefore should only be taken for certain diagnosed conditions and only when prescribed by a doctor. Adderall, a central nervous system stimulant, is used to increase dopamine levels in the brain to help people with ADD and ADHD concentrate and stay focused. It can also be used for treating depression and narcolepsy. Adderall is helpful to those who need to take it. However, it also causes many unwanted side effects such as shaking, irregular heartbeat, fever, confusion, and behavioral changes. Adderall can also be a highly addictive drug even when taken as prescribed, meaning that not only is this medication easy to become addicted to, but it can also make users go through withdrawals. Although Adderall may have positive effects on those with ADD, ADHD, and depression, it also creates many negative side effects and therefore should only be prescribed to those who really need it and know the possible harmful effects. Adderall is most commonly prescribed to help those suffering from a learning disability increase their academic performance. Some people consider Adderall a steroid that gives students using the drug an advantage over those who do not use the medication. However, people with ADHD or ADD have a disadvantage to begin with, so Adderall is prescribed to them to help them focus as well as anyone who does not need this drug. Adderall is not an advantage in a pill. It is simply a stimulant that evens out the playing field. The illegal use of Adderall in colleges has become more common. Students think that they will have an easier time studying for a test and stay more focused for the test. However, there are many negative things that come with the decision to use a drug illegally. Students can receive felonies for using a prescription that is not theirs, as well as losing their scholarships, financial aid, and job opportunities in the future. They also subject themselves to the harmful medical side effects caused by even just one pill. When comparing the many risks to the small reward, it just doesn't seem worth it to use Adderall illegally. Adderall is an amphetamine classified as a Schedule II drug. Other drugs that fall into this category include cocaine, heroin, methamphetamine, morphine, and oxycodone. Because Adderall possesses some of the same characteristics as these other drugs, it should never be made legal to use indiscriminately, as others would argue. Due to the misuse of Adderall by students who have illegally obtained the drug, there have been losses of scholarships and financial aid after receiving criminal charges. Adderall is and should remain a heavily controlled substance. There is no reason for anyone other than those with a diagnosed condition and a doctor's prescription to take Adderall. And even those who do need to take Adderall should weigh the pros versus the cons before using this medication.
So the only thing that Adderall actually does is it increases the dopamine levels in the mesolimbic pathway. Increasing these levels is what causes all the effects of Adderall, including things like increasing focus, mental processing, self-esteem, and it decreases things like fatigue and anxiety. It can help with weight loss, iron deficiencies, high blood pressure, and a lot of other things. Irregular heart beating can be caused by Adderall, but it can also be fixed by Adderall because what it does is it slows down the beating of the heart. So if people want to take Adderall, why not let them? If it were legalized, then people could use them for any of the purposes for whenever they want. It should be the people's choice as long as they're properly informed about what it does and all the scientific facts behind it. A lot of people think it leads to addiction, but these cases are actually pretty rare and is only possible if taken in really large doses. Many things that people believe are withdrawal symptoms actually aren't. And a common one is depression, because a lot of people that stop using it feel depression. But according to Dr. Charles Rayson, professor and psychiatrist at Emory's Medical School, a lot of people that reported this were already depressed, and Adderall was actually just acting as an antidepressant. So when they stopped using it, they felt depressed.
The most common argument against the use of Adderall is that it's like steroids. This is a bad comparison because it would mean that people with ADHD are being compared to weak people or people that are bad at sports. If someone is weak, it doesn't give them the right to use steroids to play sports. So there are many foods that actually naturally raise dopamine levels. If people that are weak or bad at sports need to improve without the use of drugs, then people with ADHD should as well. A lot of people say that these medications are just to level out the playing field for people with ADHD, but many doctors actually hesitate to prescribe these medications because they make people with ADHD more focused than those without. Another reason it shouldn't be compared to steroids is that sports are for entertainment purposes. Using a drug to improve something as important as your education is more reasonable. This is why, according to a poll, about 20% of scientists admit to using Adderall. Limiting their use of Adderall would be like arguing that they shouldn't cure cancer faster because other doctors can't cure it that fast without the use of Adderall. But like I said, things like this shouldn't be competitive. Also, education shouldn't be seen as competitive, so there's really no uneven playing field. In competitive environments, however, this drug should be banned. There are many reports of athletes and professional poker players saying that use of these drugs improve their game by incredible amounts, and these shouldn't be allowed. Another reason it shouldn't be compared to steroids is that it doesn't actually make you smarter like steroids does make you stronger. It merely lets you put what you have to its maximum use.
Though the majority of people are against the use of this drug, we need to remember that though drugs in general are thought of as bad, a drug to improve study habits can still be a good thing. A lot of college newspapers cover this topic because it's a big problem in colleges. And I found many articles, and MSU's daily newspaper, the State News, has an article that talks about Adderall, and their main concerns of Adderall abuse are loss of financial aid due to misdemeanor or felony charges, and neither of these would happen if Adderall were legalized. Neuroscientists as well say that legalization debates are moot at this point, comparing Adderall to a genie that has already been let out of the bottle, and that the next step is just to make it cheaper and more accessible. The government seems to think this as well because they actively give drugs like Adderall to combat pilots before their missions. The only reason it isn't legal is the risk of it becoming a societal norm, which isn't necessarily a bad thing, but would cause a huge change.
While it is easy to say that legalizing Adderall wouldn't be a problem if it were only used for academic purposes, in reality, there's no way to control how it is being used. No matter what, Adderall is still a dangerous amphetamine categorized with drugs like cocaine and heroin. With the many harmful and potentially life-threatening side effects caused by this medication, it is hard to justify legalizing Adderall to be used over the counter. As stated in Jack's argument, there are many foods that naturally increase dopamine levels in the brain and can increase focus. This Schedule II drug is just too dangerous of a medication to be used over the counter and therefore should remain under the same strict control as it is now.